while it's still not confirmed, it's been a mixed week for healthcare stocks since Trump's election victory, with some investors applauding potential changes in Medicare reimbursement policies, while others are fearing what Trump 2.0, what it might mean for health insurance subsidies and vaccine programs. Let's cover it all with Emily Field, analyst at Barclays, covering pharma and medtech, and Bernstein's Lance Wilks on all things insurance. Great to have you both here. Good morning. Emily, I'm going to begin with you, if you don't mind. I want to talk to you about that GLP-1 trade. I know you covered Novo Nordisk. Obviously, they make Ozempic. We also have a number of other names in that trade. The election of Trump, President-elect Trump taking office and his policies, what does it mean for that trade? What does it also mean for stocks that were viewed as developing weight loss drugs in the future? How does it change how all those companies are looked at?
Yeah, so thanks for having me. It was actually somewhat fortuitous timing that Novo Nordisk actually reported, hours after the election results came in. And to be totally honest, it hasn't really come up all that much either on their own conference call or in our subsequent conversations with investors, just because we think that, in terms of subsectors and verticals that could be impacted by the change in administration here, pharma is probably the least of them. And of course, you did mention that vaccine point. Novo Nordisk is not involved there. So we think the GLP-1 trade is going to continue on, although, investors are quite skittish going into some key results for Novo Nordisk.
Okay. Lance, I want to come over to you. So read your notes. You say that stocks that are related to Medicare Advantage, they traded higher after the election. Just explain this thesis to us. I got to be honest, I'm not that familiar. I looked it up. I know it's private healthcare companies that get government funding. But in general, what are those stocks, and what is the possible Trump, or what is the Trump administration possibly going to do to make those stocks kind of benefit from policy changes?
Yeah, so the stocks we're really talking about there are like United Healthcare, Humana. Those would be the two largest Medicare Advantage managed care companies. And for stocks like that, basically what you're doing is, as a senior, you can choose the traditional Medicare system, or you can choose the private system, which is Medicare Advantage. Medicare Advantage generates a bunch of savings, probably about 20% of the cost of Medicare. And then they put those savings back to the senior in the form of lower out-of-pocket expenses, additional benefits like free dental insurance, free fitness memberships, and things like that. That attracts more seniors. And so by today, about half of all seniors are in Medicare Advantage. What has happened during the Biden administration is they've really pulled back on the rates that they've given to these Medicare Advantage plans, sort of a one-time correction, and really trying to pull back on the amount that is paid. The expectation under Trump is that would be not continued at that point, that we've already got to the appropriate rate. And so rates will be stable, maybe low, but stable going forward. And you'll see margin recovery in these names.
All right, very interesting. Emily, I want to come back over to you. We were just talking about RFK Jr. and the possibility that either he would be the head of HHS, which is a cabinet level position, or he'd at least have the president-elect's ear and be able to influence policy and kind of influence whoever gets put in that position. When you look at the companies that you cover, is there an RFK risk that you're factoring in and looking at? And are there some that might benefit, some that might be hurt? Is it that black and white?
Yeah, so I would say since the election, in terms of where investors have expressed concern in our coverage, it has been the names that are overly exposed to vaccines. And within my coverage, that would be names like GSK and Sanofi. However, it's far too early to tell where anything could go from here. And obviously, what they could do at the federal level versus vaccine mandates, which are often imposed at the local and state level. It's very early days to see how, whether what could happen here, depending on who's in charge of what organization.
Emily, I've been doing a little bit of reading about this, including your notes. One thing, though, RFK Jr., he's at least said, he said he's not going to end vaccines, but he wants to make them safer. So is that definitely a headwind for these companies, or is there maybe even a possibility that they might have a chance to maybe reformulate them somehow? I'm just asking, because the vaccine business is obviously very complicated. We all got sort of familiar with it during the pandemic, but I don't think many of us think about it on a daily basis.
Well, that is a very good point, because one of the big questions out of the COVID pandemic was, the traditional vaccine makers such as GSK, Sanofi were not the ones that came first to market with COVID vaccines. Those were the new technologies of mRNA. And actually, for those incumbent players such as GSK and Sanofi, their lead vaccines are older, established technologies. So if this were to become a debate about established, well well-versed technologies versus the newer mRNAs. And in actuality, the companies we cover have almost no exposure to that. They have that in their pipeline, but not in their commercial portfolio.
Lance, I want to come over to you. Is there an RFK risk in the companies that you cover? Is there an idea that he might introduce policies that would shake up business models or significantly reduce revenues or possibly increase them?
Yeah, I think the two wild cards you'd want to think about here would be an RFK risk, presumably could be against big pharma, big insurance, things like that. And so that might run against some of the opportunities to improve rates in Medicare Advantage or things like that. I think the other wild card here would be Elon Musk. And it might be more the concept of Elon Musk and the concept of, efficiencies coming into the system and trying to take costs out of the system. That could be impactful to Medicaid names like Centene and Molina. And so names like that probably have some exposure to, who might get appointed in some of these sorts of roles.
Lance, we're almost out of time. Very quickly, tariffs. Is there one name in your coverage universe that would be the most impacted negatively?
My space is so domestic, it's very positive. Probably the key thing would be not companies that are employer managed care. And so those could have some pullback.
All right, Emily, I think it's probably a bigger question for you in your coverage universe. What names are possibly the most negatively impacted by the idea of an expansion of tariffs?
The ones that we've been able to ask so far all say that they have U.S. manufacturing for the U.S. So I think that most people are not thinking it's really going to impact pharma. But just one last point on Elon Musk. He has tweeted positively about Wegovy in the past, which is made by Novo Nordisk.
All right, that's an interesting point there. Emily with the last word. Emily Field, Lance Wilks, great to have you both.